Good afternoon, everybody. My name is Dr. Dean Sidelinger. I'm the state health officer here in Oregon and also the state epidemiologist. I'm joined by one of my colleagues today. Can you introduce yourself?
Sure. I'm Zhang. I'm one of the many epidemiologists that's been working with COVID response.
So we're here to talk about data because we know we have a lot of questions about data. There are people that follow our data on our website every day. But I want to step back for a moment and talk about that data in broad terms. For every case that's on our website, for every person who's admitted to the hospital, for every death that we report, we have to remember that that's a person here in Oregon, one of our neighbors, a neighbor who has a family and who has friends, who lives in our community. So we have to remember the stories behind the data, that they're not just numbers, but they really represent people who are getting sick. In addition to our duty to protect the health of the public, we also take our duty to protect the privacy and confidentiality of these patients, these people who have their information reported to us. And that's why sometimes people ask for specific information about a case or specific information about outbreaks or other things that we can't release because we worry it might help identify someone who's out there, and we really want to prevent that from happening. So as we talk about this data, remember the people behind the data, the people with families, our neighbors, our fellow Oregonians, and those are the people who are impacted by COVID-19. Some of our communities much more so than others. Our neighbors who are Black, African American, or African immigrant, our Pacific Islander neighbors, our Native American, our Latinx neighbors, all have been harder hit by this pandemic than other communities in Oregon. So we want to keep that in mind as we talk about our data and what we report every day.
So the first thing that I'd like to do is walk us through how here at Public Health we get your information and how we get the data that we do. So if you are going to the doctor because you're experiencing COVID-like symptoms, they will test you for COVID-19. The lab will then get the test result and then send Public Health that information. Our local public health departments will then take that information and then either interview the case because you tested positive or just store that information because you tested negative. We then take the information that is in our database to then create the visualizations and the reports that we'll be showing you a little bit today. One of those reports that I do want to show, or one of those visualizations that I do want to show, is the epi curve that is updated Monday through Fridays. This is found on our normal website, which is healthoregon.org/coronavirus. If you scroll down a little bit, you'll see the epi curve. The epi curve shows the number of people who became ill with COVID-19. We're looking at the day that they had symptom onset. For each day, we show the number of people that were not hospitalized due to COVID-19, that's shown in the orange. We also show the number of people with unknown hospitalization status, and then we also show the number of people that were hospitalized due to COVID-19. Dr. Dean Sidelinger will provide a little bit more information about hospitalizations.
Thanks, Lex. And I will say, one of the things Lex said is we post people on this graph by the date their symptoms started. And some people may be thinking, but a lot of people don't have symptoms. That's what we've been hearing in the news. That's what you've been telling us. So for those individuals, we take the date that they were tested and we go back 2 days and count that as their date of onset because they haven't started with symptoms, so we can't use that as a date to track when they may have gotten sick. When we look at hospitalizations specifically, we give a separate graph that shows hospitalizations by the date that someone was admitted to the hospital. This gives us an idea of new Oregonians who are admitted to the hospital on specific dates. And we also break this data down to show the hospitalizations across different parts of the states. We try and bring this data to you in different ways so you can see different ways that COVID-19 is impacting people here in Oregon. We know that a lot of people are interested in what's going on in their community, so I'm going to have Lex talk a little bit about some of the ways you can do that on our website.
Yeah. So another one of the visualizations that we update Monday through Friday is our testing by county. And this is also found on our main website. And this shows a graph of Oregon, and then it breaks down the number of cases as well as recovery and death data on the side here. What's nice about this visualization is if you hover over a county, you'll see a tooltip pop up with additional information. This tooltip will provide information such as the total number of people tested in this county, the cases per 10,000 for the county, and also will show the total number of recovered cases and people who have unfortunately died who live in this county. So if you're curious about information about your county, you can go to our website and look at this information.
So as you saw when we showed you the county data, for the data visualizations that we show, if you hover your cursor over different parts of the graph, you can often pull up additional information. Mm-hmm. So it's really important to do that and see some of the further data that we post on there. In addition to some of the data we walk through, we try to get additional information up on our website that people find useful. Some of this is reported as reports. For example, we have a weekly testing summary that shows in the previous week and tracks over time the number of COVID-19 tests that were done for people in Oregon, the percent that were positive, and how that trend has changed over time. When you pull up that report, you'll see that we have seen increasing tests almost every week since April as the testing supplies become available, and we continue to be able to test more Oregonians. Another report that goes up once a week is called our weekly summary. And this report has a lot of information in it. And as you go through page by page, you may notice something new from week to week as we start to add data there. This gives us an idea of the different ages that are being impacted, and we can see that over time we've seen larger numbers of cases in folks who are 20 to 29 and 30 to 39, with some of those children and adult age groups really increasing in the last month and a half. Some of this is because of who we were testing early on in this pandemic. We were looking for folks who were the most seriously ill, those who are in the hospital, oftentimes folks who are in long-term care facilities. So those ages skewed higher at the beginning. And we continue to identify cases there, but we've added additional testing capability and are able to test some other individuals. So some of these younger age groups we're really seeing associated with workplace outbreaks and social settings, social gatherings that have happened since Oregon began reopening. In addition, in this weekly report, we have information about the race and ethnicity of folks who've gotten sick here in Oregon, who've tested positive for COVID-19. And we see, like I said earlier, that many of our communities are impacted more than others. The Pacific Islander community in particular has the highest rates here in Oregon, and our neighboring state to the north, Washington, is seeing similar results. Our Latinx population is also impacted more. Our Black, African American, African immigrant community is impacted more than they are represented in the population. And this isn't because of the virus itself, but really often because of where people were exposed. Many people from some of these communities had continued to work during our Stay Home, Save Lives orders. They were more likely to be exposed and so are more likely to get sick. We also know that coming into this pandemic and continuing through this pandemic, they often, some members of our communities in Oregon didn't have as good access to healthcare. That racism and institutional bias often prevented people from getting the care and accessing the services they needed. So we continue to see that as we see cases here in Oregon. There's a lot of other information in there. I don't know if you want to talk about some of your highlights in that report, Lex.
Yeah, so that report is a collaboration of the EPIs on a weekly basis, the epidemiologists, and some of the other information that we do provide in that report is a table that lists the active workplace outbreaks, as well as the long-term care facility outbreaks. And so those who are living in our long-term care facilities, these are a vulnerable population, and we know that that these folks have been getting hit harder than others because of the way that they are in a congregate care setting. And so on a weekly basis, we do go through and we update those numbers, and so to keep you all informed as to what's going on.
I think you might also notice a newer addition to that is outbreaks in childcare settings. Mm-hmm. As children have continued to go to childcare, as parents need to work, we are tracking the number of people associated with childcare, the teachers and the children and family members who've gotten sick. We anticipate that as children go back to school in the fall, if they start to attend school in person, we may see outbreaks associated with schools. And likely this summary report is a place that you can go and look for that data. We have information in the report about where people live. Case rates by zip code across Oregon that can also help identify even to a lower level than the county level data can get you where people live who've gotten sick. That doesn't mean they've gotten sick in that location, but that's where they live. And I think that's another important piece we should talk about with our data. The data that we present is data about residents of Oregon, people who live in Oregon. So sometimes our data changes and people ask, well, why does it change from day to day? And I think there can be a lot of reasons for that. Do you want to talk about some of the reasons we changed that data?
Sure. So like I said, as cases are reported to our county public health department, they then do what we call a case investigation. And so they are calling every case to interview them, to ask them about where they may have been, their contacts that they have, and also other information about them like their comorbidities. And during this course of the case investigation, they may find out information which might make a case not become a case. An example of this would be if someone was reported as, say, for example, a Benton County resident. However, when they interview the person, they realize that this person has been living in Washington State for the past year and just hasn't updated their address. This case that was once a Benton County resident would then be transferred to Washington and would not be considered an Oregon case because they themselves live in Washington. And so Benton County would, what we consider, lose a case. Another reason why you may see cases go down in some counties is because someone may first have said that they met the presumptive case definition, which is that someone has COVID-like symptoms and have close contact with a confirmed case. We have a criteria of what it means to be to have COVID-like symptoms, and so you need two of the following symptoms, which is cough, fever, shortness of breath, loss of taste or smell, or have some sort of evidence of pneumonia. Sometimes when we do an additional case interview, we find that a person actually only has cough and didn't have two of these symptoms. This person would not meet the presumptive case status and would be considered a suspect case. And so that's another way how a county may lose cases. The data that we present every day is the most up-to-date information that we have about the cases.
So I think we can stop here. We get a lot of questions about data, but let's see some of the questions that are coming in. So Lex, I think this is a question you can answer from Kim. How many of the new cases reported each day are actually retests for patients that already have COVID-19?
Yeah, this is a great question. And so in Oregon, we are actually counting, and in the data visualizations that you see and in all of the reports that you see, we are actually counting people and not the number of tests. And so each person can really only have one positive test. And so when we say that there are, for example, 10 new cases in a specific county, these are new people who were diagnosed with COVID-19. We are not reporting on people who actually tested positive again for COVID-19 because they're already considered a case.
We had another question from Sue, which I think I'll answer, and you can chime in.
Yep.
Who doesn't understand why the case counts never add up from one day to another. And I will say that can be frustrating, but Lex explained some of the things that contribute to that. As we do our investigations, we may find out someone lives in another county, and so we move that case to the county where they live. We may find out they're in another state, so we report that to the state where they live so that they can count that case. And so we do that constantly. And this brings up another area I think that we get a lot of questions about that I'll tackle here, is the difference between presumptive and confirmed cases. So initially, when the pandemic started, every case that we reported was confirmed, meaning they had a test that looked for evidence of the virus. And if that test was positive, it showed the RNA, the genetic material from the virus. That was a case, a confirmed case. But we also have what we call presumptive cases. This is a person who has symptoms of COVID-19, and they had a connection with someone else who has COVID-19, who's a confirmed case. Because of that exposure and the symptoms they have, we are pretty sure that they have COVID-19. So we treat them as a presumptive case. Our local public health partners will do the investigation, will work with the patient to make sure that they have what they need to stay home so they don't infect others. And that presumptive case is just like a confirmed case in terms of their ability to make other people sick. So that's why we count those cases together. Sometimes we will test that presumptive case, and oftentimes we'll test that presumptive case. And if their test comes back as positive, they'll move to the confirmed case. And that's, again, where you'll see some changes in our data from day to day.
What happens if a presumptive case tests negative?
If a presumptive case tests negative, we will keep them as a presumptive case. The reason for that is they have the symptoms of COVID-19, they were exposed to someone with COVID-19, so it is still likely that they could have COVID-19 and infect others. Our tests aren't perfect. If a test is positive, it's very likely that that person who had the test has COVID-19. But sometimes, if that test is negative, it's what we call a false negative. The person may still have the disease, but the test didn't show it. And so we think that that person with a presumptive case may have a false negative, and we want to make sure that they're not able to infect others, and so we will still work with them to stay home. Let's take a question. I think this is a question for you, Lex.
Sure.
From Barbara. Is it possible to know if someone died of COVID-19 and not just with it?
This is a great question. And so for the people who die of COVID-19, this is what we consider a COVID-19 related death. For us, this is people who have died in the 60 days of their COVID-19 diagnosis, or their doctor has listed COVID-19 as a cause of death. However, as Dr. Sidelinger has mentioned, there are some people who are asymptomatic and don't actually have symptoms of COVID-19. Sometimes for these folks, they do die, unfortunately, and then the coroner may actually test them posthumously after they die to see if they have COVID-19. And so sometimes we do get reports of people who were tested after they died who were positive for COVID-19. Sometimes you may see in our reports and our press release that someone tested positive for COVID-19 after the day that they died, and this is what's happening. It's because the medical examiner is testing them after they die. So,
we have a question from Ian. Why has there been a sharp increase in recent weeks of the percentage of cases with the hospitalization status unknown? So I'll take that. You've heard about our case investigations. We don't get all the information at once. So a positive lab test comes in. Our local public health and tribal public health partners, sometimes our staff right here at OHA, interview the case, may contact their provider to get some information. During that time, we find out if they were hospitalized or not. Mm-hmm. So initially, if we don't know that, when the lab report comes over, it'll be listed as unknown, but as the investigation continues, we'll assign them to hospitalized if they were, or not hospitalized if they weren't. So as you look at data on our epi curve, you'll see that the unknown status really does decrease when you go further back into the past, and that's because of our public health investigations working. We have a question. I started this talk a little bit about confidentiality and protecting privacy, and Nancy asked, what about HIPAA laws that are supposed to protect my information? So this is a federal law that was put in place to protect people's medical information and their identities, so that it's not shared with people without your knowledge or consent. In the case of public health and some communicable diseases, infectious diseases that by law require laboratories and medical providers to report to us here in public health, that information is shared outside of HIPAA. The law requires medical providers, labs, to provide this information to public health so that we can work to do investigations to try and determine the cause of that disease, where it may have come from, and to try and implement measures that may protect others from that disease. So public health and HIPAA operate together, and we do take privacy very seriously, even if we're not always covered technically by HIPAA, as your doctor, nurse practitioner, and physician assistant are, but we're all working together to ensure your health, your safety and your privacy and confidentiality.
So I think I'll take the next question from
Okay.
Scott, who says, do you have data on active and recovered cases? And yes, we do. We have 2 places where we have this information. So one of the places that we show data on recovered cases is on that county visualization that I talked about at the beginning. And so if you hover over each of the counties, there will be a pop-up, and in that pop-up it will say how many of the cases are recovered. In addition to this, if you are in our weekly report, we are also showing a subset of cases who had COVID-19 early on and their recovery status. So this subset is a bit special because we have been calling these around 2,000 cases to ask them if they have recovered or not, meaning that they have all of their symptoms have resolved. And it's kind of really interesting because there are some cases who over 90 days out are just reporting that they were recovered. And so there are 2 places again to look at recovery data. One is our visualization that gets updated Monday through Friday, and the other is in a weekly report that's published on Wednesdays.
I think the next question may be a good one for you too. It comes from Becky, and she asks, is there data on the underlying conditions of people who die or have COVID-19?
Yeah, that's a great question. So Becky, in our daily press release, we do mention if the person who died has underlying medical conditions or not. Unfortunately, there's nowhere in our data visualizations or our weekly report where we mention what type of underlying conditions that the people who have died from COVID-19 have. And that's because some of that information is hard to collect, and also we want to be protecting the privacy of those who have died from COVID-19.
I'll take this question from Jamie, who has a question about a recent development. Will the Trump administration's new mandate that hospitals must report their COVID-19 numbers to Federal Health and Human Services instead of the Centers for Disease Control and Prevention impact how OHA gets its numbers? And the short answer here is no. Our numbers come in from laboratories who do testing for COVID-19, and they report all of their positive and negative test results to public health. Either through the local public health authority or directly in the state. We all work in the same database and have that data. Providers can also report information on a person they think may have COVID-19, and as part of our public health investigation, we may identify presumptive cases who've been exposed. And so all of that information is collected through our public health investigations, through direct laboratory reports. We talk about hospitalizations in a couple different ways in our data, and I think this is a good time to talk about it. The data that Lex and I have been talking about is primarily from our public health investigations. And as we identify someone who's hospitalized, we will report that person's condition is hospitalized. Our severe burden of disease visualization plots those individuals by the date that they were admitted to the hospital. So each one of those data points represents an individual Oregonian who was admitted to the hospital. You'll also see in our daily report where we have numbers that represent the number of people with potential or probable or possible COVID-19 as well as confirmed COVID-19 who are in the hospital. Some of them are in the ICU and some on ventilators. Those numbers come from our hospital partners across Oregon who report that data on a daily basis. And that gives us an idea of how many beds in the hospital are being used for COVID-19, and they also report the number of beds available. And there's some similar information on beds and medication use and other things that will also be reported directly to the federal government, now to HHS instead of the CDC, but it won't impact the data we have in Oregon. We get that data directly.
So I can answer Amanda's question and then have you jump in if you have more to add. So Amanda asks, what about false positives? Are you concerned that's skewing the data? And so the test that we use to confirm COVID-19 is pretty sensitive. It's called a PCR test. And we are not that worried about false positives because it's really great at picking up if someone has COVID-19 or if there is COVID-19 present in the specimen. And so we're not really concerned about false positives skewing the data.
I think there's a question here from Patricia on presumptive cases, and we touched on some of this, but we want to talk a little more. She asks, how many of the presumptive cases have turned out to be negative, and are those cases subtracted from the total? So while I don't have a precise number of cases that turned out to be negative, we do track the cases over time on a cumulative basis, meaning in total. So we look at our total number of cases, which is presumptive and positive. When we first started reporting presumptive cases, we reported each day how many were presumptive, how many were confirmed. But we know that those cases change pretty rapidly, as those presumptive cases usually get a test. If they test positive, we change them to a confirmed case. So we never subtract a case out of the total, but we will change their status from presumptive to confirmed if they test positive. But as I said before, or Lex said before, if a presumptive case tests negative, we still think they may have the disease because of their symptoms and their connection to someone who has the disease. They could potentially still infect others, so we want to make sure that they're still counted so they stay in that overall total. I think the next one might be a question I can take from Jessamine about is Oregon using antigen or pooled testing? Let me talk about pooled testing first. So pooled testing is testing multiple samples together from the nasal swabs or nasopharyngeal swabs, the RNA viral test that we've been talking about. We can put several samples in the machine together and test them all at once. If the test comes back negative, that means all of the samples, none of the individuals had COVID-19. So that could be 5 or 10 people. If the test comes back positive, that means at least one sample, one person from those samples had COVID-19. And so we go back and retest each of those individually to see who or how many people had COVID-19. Right now, that's not something that's being used by Oregon labs. It's something we've looked into and may use in the future. There was another question about antigen tests. So an antigen test is a blood test. And with this test, we can look for antibodies, which is our body's response to an infection. This can show evidence that someone may have been infected with COVID-19 in the past. And it can stay positive for a long time because those antibodies can stay in the blood for quite a bit of time. While that test is being offered here in Oregon, that's not a test that we use to identify a case of COVID-19. But it is a test that we can use to see out of a group of people how many people may have had COVID-19. And we think, in the future, the antibody test may help us with individual clinical decisions when someone's at their doctor to make decisions about care and things. But right now, an antigen test doesn't count you as a case here in Oregon or really across other states as well. We rely on the viral test that looks for the genetic material in the virus, and a new test called an antigen test, which is proteins from this particular virus that can make people sick. I'll take this next question from John. Can you provide an overall perspective on how Oregon is faring compared to the rest of the United States? I think in Oregon, thanks to the work of all of you, fellow Oregonians, staying home to save lives under Governor Brown's executive order, we've actually done very well. We identified a case in Oregon in late February. This was relatively early in the identification of cases here in the United States. We know that our neighbors to the north in Washington identified the first case, or the first case that was identified in the United States was identified in Washington. It wasn't the first case. In California to the south, they identified the first case that was linked to community transmission. So we know that we had disease here in Oregon fairly early. But we came together, we stayed home, and we flattened the curve. And that's the epi curve that Lex was talking about. We kept those numbers down. We made sure that our hospitals had the capacity to take care of Oregonians as they got sick. And because of that, we've done fairly well. Our case rate here in Oregon is one of the lowest in the country. There's a few states that are below us with much smaller populations, but we have kept that case rate down. But that doesn't mean we can be complacent, because as we've seen since the beginning of June, we've seen increasing spread throughout the state. And while most people either don't have symptoms or have mild symptoms and recover, we know that a subset of people can have complications. Older adults, adults and children with underlying medical conditions are most susceptible to those, but we've seen healthy children and healthy young adults who've had to be hospitalized, and tragically, even a healthy adult or child can die from COVID-19, and we can't tell you who. So that's why we have measures put in place to keep your distance, to limit your gathering size, to cover your face when you're out in public with a face shield like Lex and I are wearing, or a mask of some sort. And those can all limit the spread of this disease until we have an effective vaccine that can protect the broader public without getting sick.
I think I can take on this last question from Giles, which is there any data on where people are getting COVID-19? And so in our weekly report, we do have a graph that shows a bit of information that can tell you where people are getting COVID-19. In this graph, we show the proportion of people, the percentage of people who had close contact with someone else before they got COVID-19. And we are seeing that a large proportion of the cases with COVID-19 are having contact with someone else. And so while we don't have any specifics, such as if someone went to a bar or if they got it at work, we are showing that a lot of people are epi-linked together or know someone else that is a case of COVID-19.
So I think that was a good overview of the data we have. We update our data regularly, daily basis, weekly basis on our website. As we get more reports or we look at data differently, we put that up there. So we encourage you to come to our website often, look at the data, talk to your friends about the data so that you can take steps to protect yourself as this disease continues to spread in Oregon. So thanks for listening.
Thank you so much.